Alrighty, well, we'll go ahead and get started. It's 5:30 Pacific time here in Corvallis, Oregon. Thank you again for being with us tonight for our FURst Aid Reproductive Care for Large Animals, presented by the Oregon State University Carlson College of Veterinary Medicine. My name is Jens Odegaard. I'm the Director of Marketing for the college, and it's great to have all of you, welcome you from across the country and from neighboring countries as well. At the Carlson College of Veterinary Medicine, our mission is to advance the health of animals, people, and the environment through inclusive and equitable education, research, and services to the public. We have 346 students. 312 are studying for their doctorates of veterinary medicine, and 34 are graduate students in our comparative health sciences program. The college serves the public with research and direct clinical and diagnostic services through the Lois Bates Atchison Veterinary Teaching Hospital and the Oregon Veterinary Diagnostic Laboratory. A few housekeeping notes for tonight. At the bottom of your screen, you can use the Q&A feature to ask your questions. We'll get to as many of them as possible at the end of Dr. Whitler's presentation. You can also use the chat, but if you put them in the Q&A, they're a little easier to sort later for us. Also, a quick note that we will not be able to answer questions specific to your animal. For those, please refer to your veterinarian or you can contact us at our teaching hospital. But we can answer general questions about reproductive care for large animals. I'd now like to turn it over to today's presenter. Dr. Bill Whitler is a board-certified theriogenologist or veterinary reproductive specialist and an assistant professor at the Carlson College of Veterinary Medicine. Over to you, Dr. Whitler.
Okay, again, as I said, I hope everybody heard me that apologize for this being a little bit late in the year. But hopefully we'll go through some things. And because we're going to cover a variety of species rather than trying to go through one species at a time, and I apologize if you have only a specific species in mind, I'm kind of grouping things more by problem than by species, because otherwise it would take a lot longer. So I've got some examples and some things that are basically applicable to multiple species. Some are more applicable to certain species than others, but we'll hopefully go through those. So go ahead, Jens. Would advance. Am I going to see it?
You won't see it.
So I don't know what to say.
Yourself.
Will I see you? Okay. Now I see you, I think. Can you advance? Okay. I always warn people at the beginning of these lectures that unfortunately we will use some sexually explicit terms, not in a derogatory way, but in some certain instances, people might find it embarrassing or funny, but certainly not meant to be offensive. But unfortunately, that is the nature of my job. Go ahead. Going. Okay. So I'm going to cover both male and female tonight. Basically on the male end, I'm going to talk mostly about scrotum or testicular issues and then penile issues. And then the female end, talk about parturition. I know that could be an entire lecture of its own. It's oftentimes what most people are interested in, as well as then potentially perineal or vulvar issues, any uterine issues. And then people kind of forget that the mammary gland is part of the reproductive system. So we'll touch bases on that a little bit as well. Go ahead, Jens. So again, we're going to talk basically about, potentially mechanical injury. Those mechanical injuries may or may not be related to breeding. Sometimes they're just related to animals being the way they are and running into things. Some of them live in a relatively dangerous environment with plant material and other fences and things like that. We're going to talk about complications of delivery, complications of pregnancy, and then complications of the puerperium, which is basically the time after delivery. And as I mentioned, it's going to be a problem-oriented more than a species-oriented approach. Go ahead. So we're going to start with the male. Again, things where we sometimes know there was known trauma. In most cases, especially if this is a breeding animal, prompt care, whether that's something you start before the veterinarian comes or getting prompt evaluation by a veterinarian will result in the greater likelihood of maintaining fertility. So again, just oftentimes these are not necessarily life-threatening injuries, but they can be career-ending injuries if they are destined to be breeding animals. Sometimes non-breeding animals like geldings, steers, maybe it's not as important, but we're going to cover a couple of things that can be important, whether they're sexually intact or not. The ruminants, remember, so the small ruminants and cattle love to make excessive amounts of scar tissue. So the longer they go untreated correctly, the more scarring we get, and then sometimes scarring prevents the normal breeding process to happen. And then we also see sometimes nerve injury if that occurs later on. So even though they may recover what appears to be functional use of their penis, if they can't feel anything down there, you can imagine that it makes the possibility of a natural breeding much less likely because they can't figure out where they need to be. And some of these injuries can again be career-ending from the standpoint of being able to do a natural breeding, a live cover, but they may require that the semen be collected in some other fashion, whether that's using an artificial vagina or electroejaculation. But in most cases, very few times will I tell you that applying some hydrotherapy where you're cold hosing it, some type of anti-inflammatory if you have access to it, is usually rarely contraindicated in these. So if you're not sure how quickly a veterinarian can evaluate that and you have access to that, I certainly would rarely suggest that that was a bad thing to do. And you have to remember that the testicles normally, the reason they're external in most species, most mammalian species, is that the testicles, in order to functionally produce semen, need to be a few degrees cooler than the rest of the body temperature. And so when the scrotum gets swollen, as is this horse in the lower right-hand picture, those swollen scrotums can insulate the testicles so they stay warmer than normal, and that warmer than normal testicle results in damage to the semen quality. And it takes between 6 and 8 weeks for a sperm to be made. So in other words, with the injury we see today may result in infertility, not necessarily tomorrow, but maybe a few months from now. And we have to give that much time for these problems to be resolved. So you can't expect instant recovery. And in some cases you think, oh, they're doing better. And then you're breeding these animals and you find out that you're not getting any offspring. Nobody's getting pregnant. And then you wonder why, because a lot of times people don't realize that sperm takes a couple of months to be produced. Go ahead, Jens. So then sometimes we don't have any obvious trauma, and in which case, you show up one day and you look at a scrotum like this on this bull, and you can see something is clearly not normal here. And then you have to decide, well, is this truly an emergency that needs immediate care, or is it not? And one of the biggest criteria I would normally tell people, is this a painful thing or not? Is it hot? Is it warm, like it might be infected or something? And then a lot of it has to do with, how quickly did it come on? Again, if it's been slowly progressing, maybe not as likely to be a true emergency, but if it happened pretty quickly, we worry about hernias because the hernia can involve the intestines. And if the intestine gets twisted off or strangulated, then of course it can become life-threatening, and that's where it becomes more emergent. Sometimes we have more long-term hernias though. Oftentimes if the hernia is big enough, the intestines are in there, but they don't necessarily get twisted off. So the animal can survive for a while. And then the abdomen, especially in the small ruminants and pigs, contains what we call omentum, and sometimes that plugs the hole. So when we look at these, yes, it's a hernia, but it's not an intestinal hernia. And those can sometimes survive for weeks to months before they can be surgically corrected. But again, one of the biggest differences would be how painful and how sick the animal is when you acquire something like this. And remember, those intestines, though, they can start out not twisted off, but then they become twisted off. So it behooves you to have these evaluated sooner rather than later to make a game plan about how you're going to fix this. In some cases, it requires castration of one side, but that's normally has a reasonable chance of retaining fertility in the opposite testicle. The testicle, usually the opposite one that's remaining, will increase in size and actually make up for some lost ground. And so we really only lose typically 20 to 30% of fertility when they only have one testicle as opposed to when they have two. So again, in a breeding animal, one testicle can be removed, but remember, the longer that other one, that hernia stays there, the more damage there is done because of the insulation of that hernia against the opposite testicle that you want to maintain its fertility in. So if you wait too long to fix these, you can end up with some irreversible infertility. Go ahead. Other things, though, we can see in addition to hernias, we can occasionally see scrotal or testicular abscesses. We sometimes see orchitis and infection of the testicle. Most importantly, in sheep, and especially in our part of the world, we see a relatively high incidence of brucella ovis or brucellosis in the rams. We recommend they be tested before breeding. We don't see as much in the way of that in other species. In cattle, it's been almost eradicated in the United States, although it does occur in the rest of the world. Unfortunately, in the United States, contagious equine metritis has been more or less eradicated as well. But then that testicle, in addition to just being involved in a hernia, can also twist on itself. And again, thinking about it like rotating in a circle, most torsions, if they're less than 180 degrees or only halfway around, they're typically not as painful. Once they become twisted 360 degrees or more, they become quite painful. And especially in horses and even cattle, we'll see these as a painful abdomen, like a colic. So those of you with horses, especially if you have an intact stallion and he's colicking, always make sure to feel those testicles, because sometimes people forget about that part. They assume it's a GI problem, and in reality, we have to remember that. Especially in the summer months, especially in the deep south, we do see fluid buildup sometimes in the scrotum. Again, it's usually not a serious problem from the standpoint of life-threatening, but again, because it insulates those testicles, and we see this mostly in cattle. Fluid in the scrotum insulates those testicles, which again can potentially influence their fertility later on. And then it's rare, but I've actually only seen one in 39 years or so, is a varicocele, which is basically just a blood clot in those vessels. Again, we successfully removed one of those, and the ram, it was in a ram, and he went on to, so their testicle remained viable. So these can be treated. Again, in most cases, though, it's important to get them evaluated relatively quickly. Go ahead. So then other things, when we move from the scrotum to the penis or the prepuce, a couple of things we see. This is primarily more of a bull thing. I've not seen it as much in small ruminants, although they can certainly lacerate their prepuce, especially if they're, again, in a brushy area, trying to jump the fence, things like that. So again, if we see lacerations of the prepuce, because if those go untreated, we get scar tissue where they can no longer get a sufficient erection for breeding. So again, the key to those is identifying them. But if you notice these two pictures, you might say from a distance, well, they look very similar. So the upper one, the black bull, is a preputial laceration. The lower bull is actually what they call a broken penis or a penile hematoma. And it has to do with where the retractor penis muscle attaches to their penis. And usually it happens at breeding, although it can occur at other times. And it ruptures the normal tunic. Remember, the erection requires increase in blood pressure of the penis. And so that blood pressure, if there's a trauma to it, it basically splits the outside surface of the penis and allows a giant blood clot to occur. And again, the surgical options, if they're going to be done to correct that basically rupture of the penis, have to be done sooner rather than later. If you look at the literature, again, with just conservative therapy like hydrotherapy, anti-inflammatories, antibiotics, they only show about a 50-50 chance of return to service. Again, usually with surgery, they're better, but it has to be done in the first 2 or 3 to 5 days. Go ahead. And then one last thing that really is a preputial injury, but sometimes, and you can see all three of these kind of from a distance look kind of similar. This one is obviously more extreme. Certainly in any of the males, we probably see it more commonly in castrated steers or rams and wethers. But if they have a urethral stone, if they have a bladder stone and it obstructs their urethra and their urethra ruptures, they get urine underneath the skin of their abdominal wall. and then they get this excessive swelling. So again, this is a problem secondary to urinary stones, more so than it is a true breeding problem, but it's the same anatomy. Again, we see it more commonly in the ruminants, less commonly in horses and pigs. And in the cattle, it's mostly associated with high grain diets. In the small ruminants, it's associated with who knows what. Some of the diets can be affected, but historically people have said, oh, if we feed alfalfa, we don't get as many of the phosphate stones. But then we also see calcium stones from high alfalfa diets. So the small ruminants, at least for us, we see dozens of these every year. And in the small ruminants, those of you familiar with it, they do have a urethral process at the tip of their penis. That's sometimes where the stones lodge. And again, in some cases, these can be corrected by as simple as snipping that off. However, they do sometimes scar over. And people have sometimes worried if that will affect their fertility, that it does not. But the other option for these is potentially do, at least in the steers, is a perineal urethrostomy, where we make a girl out of them. But if it's a bull, it no longer allows natural breeding, because clearly the semen doesn't come out where it needs to be. Go ahead. And then sometimes we see swelling of the penis without obvious trauma. Again, this is more of a horse problem. Paraphimosis is the term we use for the inability to retract the penis into the prepuce. Certainly in horses, this needs to be addressed promptly, even in the bulls, because the longer it hangs out, the more swollen it gets, and the more trauma that it becomes. So if you've ever heard a Viagra commercial, it's kind of the same kind of way. Need to be prepared in a relatively timely fashion. If you wait too long, it becomes permanent, and then things have to, in some cases, in horses especially, we sometimes have to amputate their penis, which obviously precludes them from being a stallion. Again, we can start with anti-inflammatories and hydrotherapy, and especially in the horses and potentially even in the ruminants, it can be associated with sedatives. The one that's most commonly implicated is acepromazine, but we sometimes also see it with some of the other neurological conditions in both horses and cattle. Go ahead. And then, of course, most of you, if you have horses, you're probably familiar with beans. If you're not, you got a new horse owner, you've never had a gelding, there are little outpocketings at the tip of the penis, and they'll accumulate gray, waxy material. Not necessarily a true emergency, but some of these horses can be quite painful. So in some cases, people describe it as needing to have those removed. And then anytime we see blood in the urine, we obviously worry about any kind of trauma. Again, sometimes it's secondary to passing stones. And then occasionally we see, and we don't really understand necessarily why these occur, urethral tears, and we'll oftentimes see those in the blood of urine if in a gelding, and usually in the blood of the semen if it's a stallion. So if you're getting either of these persistently, it may necessitate that a endoscope be passed up into the urethra and actually identify where the blood is coming from. Go ahead. So I'm going to move on to the female. And again, parturition is something I get a lot of questions about, and we see a lot of emergencies with this. So I'm hoping I can create a little bit of education on things that you can do either by yourself or before help can arrive. Remember the normal delivery, and I put in everything but pigs. And even in pigs, they normally deliver, kind of imagine yourself diving off a diving board with the front legs extended and the head and the neck extended, similar to the picture, the top picture. Okay, pigs though, they're kind of like a potato. Sometimes you can get them out even with their head first and their legs back, depending on the size of the piglet. But again, in cattle and small ruminants, and horses, we expect that animal to be delivered head first or butt first with the legs extended. Okay, if the legs are twisted back and it's a caudal present, so if it's coming butt first, we call it a caudal delivery or posterior delivery. If it's cranial, head first, it's cranial or anterior delivery. And again, the neck and the nose should be extended. And normally the calf or the foal is right side up relative to the dam. So if you look at these two pictures, and I emphasize this because sometimes people get this they don't understand this, is that if you see those front feet, okay, if the soles of the feet are pointing downward and it's a forward delivery, a cranial presentation, those soles should be pointing towards the ground. If everybody was, imagine the animal is standing up. And if the soles of those feet are pointing up towards the sky, you can see that would be a caudal presentation, or it'd be a backwards. So sometimes people see a caudal presentation and they say, oh, it's upside down. Well, it's not upside down, it's just a caudal presentation. And it's kind of important, if you're going to deal with these, to recognize what you have, because if you've got a cranial presentation or forward presentation, it's important that the head be there in addition to the two front legs. Obviously, if it's a caudal presentation, I'm not as worried about the head because it's at the other end of the fetus. Okay, so if the head is not up in the birth canal and you've got two front feet and you just start pulling, you've probably made things worse instead of better, because now the head is even further twisted back as opposed to maybe just stuck. Because you'll also notice in the top picture, if you'll notice where that calf's nose is relative to its forelegs, okay, the cannon bones are the bone between the ankle and the knee, or the carpus. And you can see normally with that head extended and the legs extended, that nose should be at about the level of the middle of that long bone, okay, that cannon bone. If you're seeing front feet and the nose are basically at the same level, then you might want to, you probably are going to ascertain most likely that the elbows are flexed. So imagine if you flexed your elbows and put your hands up to your face, they'd be more at the level of your head. Whereas if you stuck your hands out in front of you, again, like you were diving off of a diving board. So if the nose and the front feet are at the same level, it's probably that you have what we call an elbow lock. And in some cases, that's as simple as pushing the head back in slightly and then pulling on each leg one at a time with appropriate cleanliness and lubrication, which we'll get to, and bring those elbows up. And then once you've got those elbows extended, oftentimes you can deliver these. But if you start pulling on those front feet with the elbows folded, flexed, all you're going to do is embed that calf or that foal or that kid or that lamb into the pelvis of the dam and make it a lot harder to get delivered. So it's important to evaluate this. And so then the decision is deciding which is a foreleg and which is a hind leg. So next slide. So again, how do you tell if it's a front leg or a back leg? If you think about it, if you've got a foal or a lamb or a kid or a calf at home, if you feel its elbow and you feel its hock, or the the largest joint at the bottom of the leg, okay, you'll notice they kind of feel the same. But the difference between the elbow and the hock is if you follow that elbow or that hock towards the foot, you'll notice on the front leg, you've got a big joint. You've got the carpal joint in between before you get to the fetlock and the hoof. Whereas on the hind leg, you've got the hock and then you've got the fetlock. So you don't have a second joint in between. So with some careful decisions or evaluation, hopefully you can decide whether it's truly a front leg or a back leg. Because again, it changes how much you're going to pull. Because if you don't have the head up and it's a cranial presentation, you can make things worse instead of better by pulling on it too soon. So it's important to evaluate these. Okay. And then obviously, if you might feel a tail, that's pretty easy. Oh, I think this is a tail. And again, sometimes all you feel is the top of the head or the poll. So you might have ears, but no nose. And again, that's something else that you have to correct before you start pulling, because he's not going to be able to deliver with the head twisted back, even if it's coming straight. But if the head is tucked underneath, like it's got its head down to prey, that's going to be more difficult. We have to stop, push everything back in slightly, and then basically pull the nose up so it can be delivered in the normal fashion. So next slide. So I kind of like to let people know, if you've intentionally bred your animals, that you've had some time to prepare for these. Obviously, I acknowledge that there are some good things on the internet and there are some bad things on the internet. And then there might be a few people out there who don't even have access to the internet, and I respect that. And maybe so if we've got international people, maybe don't have a local library, but most towns still have a local library, believe it or not. It just takes the time to go down and try to find some books. but we want to basically be as clean as possible so we avoid problems down the road, and then use some kind of good lubricant. Okay. I try not to use too much of a drying soap. So things like Dawn detergent, which are really good at taking grease off, really dry out those tissues. So I stick with something simple like Ivory Liquid or possibly betadine or chlorhexidine scrub. But you know, again, cleaning them up, buying, keeping a pair of, you know, you can buy the sterile long sleeve gloves at most feed stores for artificial insemination. At a minimum, even just latex gloves or nylon gloves, or even bare minimum is clean your arms up really good if you have to do this bare armed. There are water-based lubricants, there are oil-based lubricants. Could you go one more slide? Yeah. As far as the lubrications, again, the water-based lubricants like KY jelly, you know, you can buy OB lube at some of the feed stores, again, in bigger quantities like gallon jugs. I was taught by the person who taught me reproduction years ago that Vaseline is the superior obstetric lubricant. I do think Vaseline does a nicer job of protecting the mucous membranes. I've heard people use Crisco. I personally have not used Crisco. I will tell you, if you use Vaseline, it's incredibly messy if you ended up doing some of this stuff barehanded. The problem with the gloves and the sleeves is a lot of times you lose some of your ability to feel things. Some people might use mineral oil. We worry a little bit about mineral oil because if we can pump it into the uterus, the problem is if we end up doing a C-section later, that oil can leak out into the abdomen, which is detrimental. So normally I don't recommend mineral oil. But again, Vaseline, Crisco, something like that in a pinch. Again, trying to keep it, even just soapy water is okay and with nothing else. But again, it can be drying. And then some of you might have experience using some of the polymers like J-Lube. J-Lube is incredibly slippery. It's a powder that you mix with water. And it's a great lubricant. It can be pumped in using a stomach pump and a tube. The problem is, again, similar to the mineral oil, if we pump it into the uterus to replace the natural fluids and we end up doing a C-section, if that leaks into the abdomen, it can be fatal. So I typically only recommend the use of the J-Lube if you know that a C-section is not going to be an option for this obstetrical assistance. Next slide, please. And then, of course, our worst case scenario is the uterus ruptures. And unfortunately, cows have a pretty tough uterus, but if you do enough of these, even in cattle, we could rupture the uterus. The small ruminants are the ones we probably see this the most in, where people have trying to, again, push the fetuses back in, mostly in the smaller goats like the Nigerian dwarfs. And then they rupture the uterus. Again, the mare's uterus is also not as tough. And so obviously the ruptured uterus can, end up being a fatal event for the dam, and then oftentimes in the babies as well. So we do want to be really careful about these, and that's why I caution people, know your limits, because that's obviously I have the advantage and veterinarians have the advantage of relaxing that uterus either with an epidural or with certain drugs we use, which the average client cannot do. So I do caution people about these. We see several of these every year, and it's always a sad day for all of us. Okay. Oh, and the one last thing, of course, in the small ruminants, we don't see it quite as much in cattle, and obviously much rarer in the mare. Make sure that all of the legs belong to the same animal before you start pulling. Again, especially with lambs and kids, you'll have 2 or 3 or even 4 trying to come out all at once. People will say, oh, there's 2 legs there, and they start pulling, and one leg belongs to one and one leg belongs to the other, and that doesn't work. And in some cases, we actually see the front legs and the back legs, even though it's the same animals, they're all coming out at the same time. So if you can imagine this kid that's sitting here on this picture, if it's all 4 feet were coming, it could really be a disaster. So that's the other part of it, is only identify which legs are which, but make sure they all belong to the same fetus. Go ahead. So Birthing, again, is its whole other, problem. We're going to talk about some of the other female parts. I'm going to mention prolapse vaginas here in a second. I have this picture. This is actually a mammoth Jenny. She actually fell down a ravine north of here and came in, and they called us because they said she's coming in with a prolapse vagina, and none of us had ever seen a prolapse vagina in a horse or equine before. So we all rushed down here. Well, in reality, she was just very swollen from having fallen down into a ravine. So that again, we're going to cover basically the other parts, the perineum, the vestibule, vagina, and the uterus, and then as well as the mammary gland. Next slide. So again, things that can happen to the caudal reproductive tract, the back half of the reproductive tract. Obviously, we can have trauma from breeding. We've actually occasionally see mares that are bred by geldings. And so people will bring in a mare and she's swollen, she's bleeding, she's got vaginal trauma. And you say, well, is there a stallion? No, but there's a gelding. Some geldings can be pretty efficient breeders. So that's always the possibility. I've had horses, do crazy things like run into sticks and stuff. Again, in other species besides the horse prolapse vagina, we occasionally see in horses blood coming from the vagina. Again, these are mostly pregnant mares, but it can occur in any older mare. They'll sometimes get varicose veins, believe it or not, in their vagina. And those mares will bleed. Sometimes it's pretty severe. Oftentimes it's a nuisance until they foal. Rarely is it life-threatening, but it's certainly a nuisance. And then, of course, we get trauma from the birthing process, where we get tears of the vagina, the vestibule, or whatever, at birthing, and those are shown some in the next slide. Go ahead. A couple slides, sorry. So we're going to start with prolapse vagina. People sometimes think this is a uterus, but in reality, prolapse vaginas, and again, we see it more in the ruminants than we see it in horses or pigs. It's prepartum, in other words, before they've delivered. The really mild ones are not as much of an emergency. Those are the ones that are sometimes the cow, ram, the ewe or the doe lie down. Their vagina prolapses while they're lying down. As soon as they get up, it goes back in, because obviously as the babies get big, there's just a lot more pressure there. In most cases, those can just be kept clean, put some kind of emollient on it, like Vaseline, preparation H, some people use because it reduces some of the swelling. I typically avoid the things with the cortisols in it, the cortisone, because again, the cortisones in late gestation can induce a premature delivery. So we're mostly just keeping it clean, keeping it moist. Obviously, they get more severe when they stay out, even when standing. And then the most severe ones involve both the cervix as well as the urinary bladder. And you can probably imagine the more that's sticking out, the more emergent it becomes. But it's usually progressive. In other words, you rarely find them just all of a sudden walk out one day and everything is prolapsed. It's usually that they start out like this one in this picture. And now the next slide. And then they progress to things like this, where, again, clearly the one on the upper right has been out a little while. It's got a lot of manure caked to it. And then these, because again, they have continued exposure, they dry out, they get more irritated, they keep straining. And then if you're in especially cold climates, they can get frostbite. And then again, some of them, because they're continuing to strain, then they'll get a prolapse rectum on top of their prolapse vagina. Okay. The severe ones, of course, we need to replace, again, usually with some kind of epidural. And the problem with any type of replacement that we do with suture needs to be opened at birthing, although some people will actually put, some of you may know what shoat rings are, or pig rings. It's to keep them from rooting. They're kind of like a staple. Some people put those in and then lace them up like a shoe. The idea being is that the staples come out when the birth starts. I've never actually tried to do that. They do make plastic retainers that are used in the small ruminants. Again, they can deliver with those in place. And then the lower pictures show what are called the Minchev Profix pins. And they basically go through the upper back through into the vagina. And they've got these plastic buttons on them and a piece of suture. And you basically hold everything in place because those do allow birthing the cat. And again, I've never done anything but a cow. There's not enough room in a small ruminant. And I don't think a horse would tolerate this, but they can deliver through these. But you can imagine these can be somewhat traumatic. I've also seen these pull through where they leave a hole in the vagina when the stitches come apart. So for me, they're kind of a little bit of a last ditch effort when I can't get anything else to work, or when a client can't absolutely positively monitor them for birthing to take other stitches out. And then there's a technique where you can do a deep suture through the cervix, passing it into the abdomen and back. But again, it's pretty invasive, so only reserved for the worst of these. Next slide, please. So then things that can happen in the uterus, again, pregnant or not, we can sometimes see uterine infections. Most of the uterine infections we see in the ruminants and potentially in pigs are associated with ovulation or having a retained corpus luteum because it's a hormonal issue. The exception to those are mares. Mares oftentimes get uterine infections or pyometras because their cervix is scarred for whatever reason. So again, these animals usually aren't really sick unless they've been progressive for quite some time. Again, the ruminants, sometimes it's as simple as bringing them into heat. The horses sometimes need some kind of surgery to fix. I can't not mention uterine tumors or neoplasia. We see a fair number of uterine tumors. Pigs are the ones that are notorious for this. That's why most pet pigs are spayed younger so that they can't develop these uterine tumors. And pigs are kind of mean when they're in heat. So oftentimes pet pigs get spayed. Small ruminants, the sheep and the goats, are not as likely to be nasty. So a lot of times people have pet small ruminants that they're never going to breed. And they're intact and they just go through their heat as long as they don't have any males, so not worried about it. But we've been seeing an increasing number of those who develop uterine tumors later on in life. And so we get these presented as a bloody vaginal discharge or abnormal vaginal discharge. And then we evaluate them ultrasonographically or with a CAT scan, and we find uterine tumors. And then, potentially have to do pretty heroic surgery to fix those if we could fix them at all. Postpartum infections we see, again, what we call a metritis. We can see that sometimes just because of the normal birthing, and sometimes because of retained placentas or retained fetal membranes. And then prolapse uterus is the other thing we see. So go ahead, next slide. So prior to a normal birthing, obviously we sometimes see abortions or stillbirths. Again, these are in some cases can be dystocias, oftentimes depending on the age of the fetus being delivered. If it's small enough, it's delivered uneventfully. Remember, there's a certain number of diseases that are contagious causes of abortion in all species. And so isolation of any animal that's aborted from all of the other pregnant animals on your farm is always advantageous. And remember that especially in the small ruminants, a lot of these diseases that cause abortion in our sheep and our goats are also transmissible to humans. So you do want to use caution if those are your species of interest and you're having abortions that, people can get sick from that. This mare in this picture, this is actually just a twisted cord. This is kind of unique to the mare because she has such a long umbilical cord that sometimes it just twists around, and it's just an unfortunate accident of gestation. Usually these foals are 9 to 10 months along, so they're pretty close. And there's really no way to predict these. They just kind of happen. The other infectious problem we see, again, with the pregnant animal is a placentitis or an infection of the placenta. And again, especially in the mare, but sometimes in the small ruminants, less commonly in the pigs, or in the ruminants and less commonly in the pigs, is we get a premature lactation. And we get a premature lactation because the fetuses are stressed and then they go into a premature labor. So again, even though these may not be a life-threatening emergency, I caution you, anybody that has a pregnant animal and you know your due dates and you've got milk coming out in the udder sooner than you expect it to be, to have those animals evaluated. In some cases, we can prevent the abortion by treating the infection. In some cases, the train has already left the station and we can't, but again, it behooves you to not just kind of write it off as oh, she just makes a lot of milk and she's starting early. Be sure to have those animals evaluated if the udder is developing too soon. Next slide, please. And then, of course, probably all of our worst nightmare is the prolapse uterus. Again, you can see in this lower left, I'm sorry, the picture is a little fuzzy, is a goat, because a lot of times people think only cows get this. We see this in goats, we see this in sheep, we see it in pigs occasionally, and of course, in the upper picture is actually a mare, which is fortunately less likely, and in my hands, more likely to be fatal as well, sometimes if we get these pushed back in. So again, just bear in mind, if you see something protruding and the animal is still pregnant, it's probably a prolapsed vagina, not necessarily as urgent as if she's just had her baby and now there's stuff hanging out. If it's not just the placenta, and that's the other call we get every year, is people think it might be a prolapsed uterus, and it turns out to just be the retained fetal membranes or retained placenta. And that's okay. I'd rather, tell you to have it checked sooner than later, because again, prolapse uteruses are a life-threatening condition. Again, we see infections in the uterus postpartum. Sometimes it's because of obstetrical assistance. This is why cleanliness and lubrication is so important. Again, retained placentas can predispose them to this. Again, mares the same way. And the other thing I talk about, again, I see this more in horses than I see it in other species, but horses like being out moving around. The uterus really likes being exercised. If the foal is sick for whatever reason and the mare has to be confined in a stall with the foal, people kind of get so focused on the sick foal that they forget about the mare, and those mares, because they're locked in the stall, either because of the foal or maybe because of their own lameness or something like that, are at a greater risk of postpartum infection. So it's important to not just be thinking about the foal in those situations. Make sure that the mare gets attended to. The other thing about these postpartum problems, both the infections as well as retained placentas. Retained placenta in the dairy cow is typically a lot more of a problem. The dairy cow is metabolically a lot more challenged than a beef cow. Certainly a dairy goat would be the same way. The other thing you have to appreciate is that every time the baby's nurse, oxytocin is released. The oxytocin causes the uterus to contract. It helps expel the fluid. It helps expel the placenta. And so anytime you've had to assist in a delivery, when you get live babies and they're nursing, I always feel like these are less likely to be a problem than if we lose all of the offspring in the delivery process, and you've got no natural oxytocin release, which again contributes to the natural cleaning process of the uterus. Next slide. So again, I mentioned retained fetal membranes. Again, less likely to be a problem, emergency problem in the ruminants, especially with nursing offspring. In the mare, our biggest worry is that they develop placentitis, or they develop laminitis or founder, which again is probably the life-threatening condition that we see here. In this bottom right slide, you'll notice this is actually two horns of the uterus of the placenta. One was stuck, one had come out, was most of the way out, and that one was stuck for several days. But again, these become pretty urgent from the standpoint, especially in the horse, of becoming life-threatening. And as I mentioned, in beef cattle, the ruminants, except for the dairy cattle, unless they're really sick, if they're not running a fever, they're eating well, they really probably don't need much in the way of treatment except monitoring. I don't necessarily ignore them, but I make sure clients are aware that it's not as much of an emergency in a beef cow or a small ruminant if you've got nursing offspring. But again, the animals like the dairy goats, dairy cattle, only being milked a couple of times a day, we don't get all that natural release of oxytocin that we see with normal, nursing offspring that typically are nursing every hour or two. Next slide. So again, other things that can happen. The birthing process can be quite traumatic to the reproductive tract. We sometimes see blood clot, tearing of the uterine vessels, what we call, and it bleeds into the broad ligament, or in some cases it bleeds out into the abdomen. And so these are most commonly seen post-foaling in the mare. Those mares are usually colicky, pale mucous membranes, eye, high heart rates. And again, these are very much an emergency. These can die quite quickly on you. In the cow, mostly where I see broad ligament hematomas is that they've had a prolapsed uterus, and you spend all the work getting the uterus back in, and then the cow dies anyway. And when you necropsy them, they have a broad ligament hematoma that basically was bleeding and stretching the uterus out to where it was outside the cow and then pushed back in. And then they die from the bleeding out internally. In most cases, surgery is very unsuccessful because there's so much blood in there, you can't really figure out where anything is. So mostly it's just a question of keeping them quiet, sedate them if you have to, and allowing hopefully that the normal clotting mechanisms work. So these are kind of difficult to get a handle on sometimes. Go ahead. And then of course the birthing process can cause perineal trauma. You can see this up this left-hand one. Basically, it was a full thickness where the foal managed to get its foot through into the rectum and then kept coming and ripped a giant hole in it. The mare in the lower right-hand side, foal came out, but then went back in. So now it's just got a full thickness tear. And you can see in the upper right hand, that one is healed, but she's still got a connection between her rectum, or anus, and the vagina. So she's got feces coming out of her vagina instead of coming out of her anus. And so obviously those need to be corrected if we want to get these animals pregnant in the future. Sometimes if they're pretty minor, you can fix them right away. People see these and they want you to do some kind of surgical correction. But I will tell you that that tissue is very traumatized. It rarely holds sutures unless they're very, very minor tears. You're better off letting it heal, which takes several weeks, and then do a corrective surgery on it later. Go ahead, next slide. So I'm going to finish with the mammary glands. Again, any of you that have had nursing animals, if you've had enough of them, we do occasionally see mastitis or infection of the mammary gland. The upper left-hand picture is actually a mare. Those of you that have horses, I hope you realize that most mares have two teat orifices. So there should actually be two tiny little holes in their nipple. And when you express the milk, you should get two separate streams. Occasionally, you'll see a mare that doesn't have two, they only have one. So they're similar to a cow or a goat or sheep that has a common teat cistern. But most mares have two. So you want to make sure that both sides of that udder have normal milk. One side isn't hot, painful. I will tell you, I have seen more mastitis in non-lactating mares than I've actually seen it in lactating mares. And I've seen it in horses present actually as a lameness because that udder is painful when they swing their leg by it. Obviously in the ruminants, we mostly see this, and in pigs, we mostly see this as a postpartum condition. Again, depending on the situation. Systemic antibiotics, local antibiotics, and your worst case scenario is, of course, what we call a toxic mastitis, which is a really hot bacterial infection, which can cause pretty severe systemic illness, and in some cases, death of the dam. And in the small ruminants, sometimes you'll hear it described in cattle as blue bag. That's that one in the lower picture. We do occasionally see mammary tumors in our animals as well. Again, usually not associated with lactation, obviously, typically associated with older animals, but certainly not as common. And then every year we see animals that have a precocious udder, have mammary development that's unrelated to lactation. In horses, they'll call it witch's milk. We usually see it in more obese horses. We sometimes see it in older horses. Not many good treatments for these. And we see it in the pet goats, again, because they cycle over and over and over again instead of being pregnant. And it's a really big problem in those goats. And to be honest, again, mastectomy is probably the treatment of choice for it. People have asked us about spaying these goats or taking their ovaries, and most of them, by the time the udder is enlarged, it's actually too late to take their ovaries out. So with that, I'm happy to answer any questions. I think that was my last. Q&A. Nice. Oh, you're gonna have to show me this. Okay.
One was, can you address the living problems with camelids and the head and neck are bent backwards?
Well, they're like every other head and neck, and unfortunately, they do have a long neck. And so again, I think the key to those is identify whether it's, and again, caudal presentation, those are certainly less common. And so you probably always want to assume that it's four legs, front legs, I don't want to say all four legs. And if you see just feet, clean them up, reach in gently, make sure there's a nose there before you just start pulling on legs. Because again, if the nose is not right there, and you pull on the legs, if the head was only a little bit back, once you pull the legs out, it's a lot more bent. And then again, you just can't oftentimes reach in far enough to be able to, grab the head. Now, in some cases, if you can get a chain or a strap of some kind around the neck, again, it usually though requires a certain amount of relaxation on the part of the dam, either again with anesthesia or epidurals, to be able to push the shoulders kind of back in, to be able to get a loop around the neck, and then pull on the neck to where at least you can reach the head, and then potentially get the head twisted up. But they are a real challenging species because their leg is so long. I wish I had a simple answer for you. I see them now, Jens. The second question was, please describe the symptoms and treatment of frost damage in bull testicles. So of course, the original intention of the Society for Therio came back from a really cold winter back in the 50s, where the Rocky Mountain Society for Bull Fertility was evaluated. And so what they found is after a really severe winter, because of the frostbite and the scrotums were basically froze off, those scrotums were shorter than normal because those scrotums were small, keeping the testicles closer to the body wall. Those testicles were overheated, and they were not making normal semen. And so I think it's a prevention is really the treatment, rather is the goal rather than treatment, because if that scrotum is so damaged that it's unrepairable and it basically sloughs off, so similar to like banding a calf or a lamb or a kid, once we lose that testicle, once we lose that scrotum, and it can no longer, the testicles can't move up and down in their normal process of thermal regulation, it's really too late. What would cause a cow not to bag up prior to giving birth? Not as probably an easy answer for me as in horses. We sometimes see that in horses related to endophyte infected fescue hay or grass. Again, not as commonly reported in cattle, but certainly something that would have to be a consideration. And oftentimes I'd be thinking about other nutritional answers, again, depending on your, the protein level of the cattle, potentially some of the macro micronutrients, copper, zinc, et cetera, we blame on everything. And then in some cases it's heritable. And in some cases it's just a hormonal imbalance within the fetus, in which cases, some cases just related to that particular pregnancy and doesn't happen again. But again, and potentially could be affecting the dam, in which case, if she has a history of never making milk, she's probably not an animal that you want to keep in the herd, because there's a likelihood that she's also going to pass that on to her offspring. Most common reasons for infertility in female goats. At least in my hands, probably the most common reason we see for infertility in female goats is previous delivery trauma. And so again, they had a previously difficult birthing, and then they're not getting pregnant again. We usually associate that with presumably some kind of cervical damage, maybe vaginal damage. We see that more. Now, if it's an animal that's never been bred before, we sometimes see congenital defects, not necessarily a heritable defect, but a congenital defect. In other words, they're born with it. You have to appreciate that the reproductive tract of the female kind of starts at two ends and then merge in the middle. And so sometimes when the uterus, which starts internally, and the vagina, which starts externally, they're supposed to meet in the middle and they're supposed to connect. Sometimes those connections don't occur, in which case we just have a blind, we have an incomplete cervix, we have an incomplete uterus, we have an incomplete vagina. And so that doesn't allow the normal breeding process to occur. The gold colored fetuses, usually that's meconium staining. And so again, the first feces that's passed in their newborns is called the meconium. It's usually a dark, kind of thick type of manure. It's designed to keep the intestinal contents from escaping into the uterine environment. So we know that during periods of stress, if one of the fetuses or all of them are stressed, they'll pass their meconium before they're delivered. And that creates those gold colored ones. So if it was the third, that one had probably been either waiting too long to come out. I don't know if it survived or not, but oftentimes it's related to stressed fetuses. When we do C-sections on birthings that have been in labor for a while, it's not unusual for us to see meconium staining. And again, if you have access to information, just Google meconium, meconium. Is precocious udder from genetics or from mastitis? At least in the small ruminants, I usually don't see the precocious udder. I usually don't see mastitis associated with the precocious udder in the small ruminants. Usually when you express the fluid from those mammary glands, it's either a cleared, a straw colored gray, or sometimes even kind of a smoky gray. It's really not milk. Sometimes it is milk. Again, more times than not, people call and say, oh, I think my goat has mastitis. And when we look at the milk, it's really not infected. It's just producing it. In horses, again, usually it's not considered an infectious process. I'm not sure who you're asking about, but we again see it in the obese ones. We sometimes see it more in the spring when the grass is coming on, because all of a sudden their caloric intake goes up, and it's just a hormonal thing that they go through. The other thing, again, when we see it in horses, because of their spring transition, remember they usually only breed during the spring and summer. The first few cycles of the year are very long cycles, and again, the hormonal influence there keeps them in heat for longer than just their normal 3 to 5 days. So again, in my hands, the precocious udder is not related to an infection. What are the pros and cons of not drying up a cow for birthing? The biggest con is that if you're milking the cow up to the time of birth, remember the calf is dependent on that first milk, the colostrum, for all of its antibodies for the first few weeks to months of its life. So if you're continuing to milk that cow, or potentially any of the small ruminants, or potentially even in mares, I've had people tell me, oh, their yearling foal is still nursing, the mare is bred again. Well, if the yearling foal is already nursing all of the colostrum out, when that foal is born, that animal is born, there's no colostrum. Remember the production animal, the farm species, the cattle, sheep, goats, pigs, and even to some degree dogs, are dependent on that first milk, that first colostrum, for all of their immunity for the first few months of life. Can a male castrated goat have a precocious udder? Not that I'd be aware of. Mostly the male castrated goats, I hate to say it, are just fat down there. But there is mammary tissue in the males, just like breast cancer is a possibility in men. I have never seen that. Have you? Like I said, it's theoretically possible, but mostly for me, if you tell me it looks like he's got an udder down there, my suspicion is he's just got fat in where his scrotum used to be. Thank you for all the questions. Thank you for attending. I'm looking at, I got people from all over: Seattle, New Jersey, Washington, California, Missouri.
think that's enough questions. I'll share a few more slides if you want to turn your mic off.
Okay,
We'll just-
thank you for coming.
Thank you again for everyone coming tonight. Going to share just a couple last slides with our contact information, etc. So if you're looking to get a hold of us, you can feel free to reach out to us at our Lois Bates Atchison Veterinary Teaching Hospital Large Animal Clinic. Our phone number is 541-737-2858, or you can reach us at la.reception@oregonstate.edu. If you have event feedback or questions, please feel free to reach out at vet_editor@oregonstate.edu. Finally, I just want to let you all know that we'll be putting up a copy of the slides as well as a recording of this presentation at vetmed.oregonstate.edu/FURst. That's with a U, as in fur, -aid. And that's where you can also find out about future presentations in this series. So thank you all again for joining us from all over, and we hope you have a great evening or rest of your day in whatever time zone you're in. Take care.